The National Health Insurance Authority is proposing 1% deduction from our salaries to alternatively fund the scheme. What do you make of this proposal? My name is Kojo Achman. Join me on this episode of News Connect as we speak to some members of the public. Stay tuned.
I think for me, I would say it hasn't really benefited me that much because even though I don't used to go to the hospital, but I think once when I made chance to go to the hospital, even though I was having the national health, I had to pay for some certain drugs, which I think wasn't fair on my part, that after giving me that kind of, you still allow me to pay for some certain drugs, which I don't think to be right. So I don't think it's something to come really serve a better purpose.
This is why the authority has proposed alternative source of funding. One, they want to introduce, it is proposing that there should be health taxes. Two, that every worker, informal and then non-formal and then formal, you should pay 1% of your salaries to fund the NHIA. And also government should also look at ways of getting money from the oil sector to fund the national health insurance policy. Do you think this is a very good alternative source of funding?
I would say it's a very good alternative source of funding because if that will come and make it very vibrant, then I think it will serve the purpose for all nations. If everybody will be able to give that 1% and how they'll be able to take that in these democratic states, I think people would like to share their views and even accept that better.
But we have, people have been paying a percentage from their SNIT contributions to fund the NHIA, and now this proposal.
But I don't think it's everybody who has been funding from the SNIT to the NHIA, which is the problem. But for this fact, it's going to be within the formal and the informal. Yeah. So I think everybody is going to make progress in that, which is going to kind of accumulate some huge sum of money to be able to facilitate that program.
So you think it's a right proposal at this current state?
I think it's a right proposal, and the government should push forward for it.
As a citizen of this country, so far so good. Listen, that I also have a health insurance, and what pains is that it doesn't cover everything. But I wish that it will cover, one, my sister was sick, my sister had a kidney. The kidney doesn't cover, which I'm very sad about that. So if the government can also consider and certain sickness doesn't cover, if only we could also and to use the health insurance to cover, I think to go a very long way. But I support that every worker should contribute. They can take at least 1% from his pay. After that, I agree with him. I agree with the government. Yeah.
You agree with but then my income is different from your income. So if you are saying that we should pay 1% of our incomes to support the national health insurance scheme, then you'll be unfair to certain people.
At least those people should also consider that no one knows what will happen to him or her. I think he or she must consider that after health, you shouldn't pay with health, especially health insurance. Because if people will consider and examine he or herself, I think it will go a very long way. To me, I support it 100%. No two words about that.
I think with that aspect or in that regard, it's a step on the right direction, because you can see people are taking in alcohol and so on and so forth. At the end of the day, because the insurance lack finance to actually help those who are sick in terms of taking in alcohol and other beverages, that will be a problem to their body. So if government has come out with such a proposal, I think it's a step on the right direction. So they will be able to let me say cure or help those who are addicted to such drugs. Yeah.
Just like what my brother just said, it is in the right direction. It will deter a lot of people from taking, especially cigarette. and alcohol, if government can put a tax on that, the money that will accrue from that can go a long way to support this the National Health Insurance Scheme. And I think the government should implement it as early as possible.
Now, let's come to the subject of taking 1% of everybody's income nationwide at the formal sector and the informal sector to fund the national health insurance. In fact, their argument is that per the world standards, funding capping for the health insurance schemes should be between $86 to $100. So what we are paying currently as premiums are very, very inadequate to fund the scheme. So therefore, they want to propose that each worker in Ghana, so far as you earn an income, you should pay 1% of that income monthly to support the scheme. I don't know what you make of this proposal.
It is a very laudable idea, but I find it a bit puzzling. I don't know how government is going to be able, especially the informal workers, to be able to get that percentage from them. So far as the formal ones are concerned, I don't see any problem with that. And I don't think that percentage, 1%, will affect people's salaries so in any adverse way. But that of the non-formal, that is where the problem is. How to get that money from them, that's what I'm also thinking about. Yeah,
just as my brothers, it's so difficult in that aspect to that. But with the former, because probably their salary go through the banks and so forth, the government will be able to, do it. But with the non-formal, it's difficult. But like you said, we don't know how that can be done, which of course is going to be very difficult. Of course, it's going to be very difficult in achieving that plan.
For that one, I don't agree. Me personally, I don't agree. You see, for this, we are all praying a country should develop well. And most of people are complaining in the system for financial problem. And see these people complaining about the financial problem, and there is going to be deduction of money. Think about it. Just think about that.
Already, those in the public sector, sometimes they find it difficult to even get their take-home money. You see, sometimes 2-3 months they've not been paid. You are going to tax it again. But
this is just a small margin that is going to cater for your health.
It isn't everybody that has subscribed to it, and even those who have done it, sometimes they get to the hospital and they are told there are some of the drugs that the health insurance doesn't cover, right? So why should I pay for something which I wouldn't benefit from it? All right, yeah. So I don't think it should be deducted from their salary. If it should be deducted, it should be deducted from the big shots.
That will be all for this episode of News Connect on City TV. My name is Kojo Ajiman. Let's connect soon.